Hi, and welcome to the Behavioral Health News Spotlight on Excellence series, where we feature exceptional leaders and innovative healthcare solutions that are raising the standards of care in the behavioral health community. My name is David Minot, and I am the Executive Director of Mental Health News Education, the nonprofit organization that publishes behavioral health news and autism spectrum news. Our mission is devoted to improving lives and the delivery of care for people living with mental illness, substance use disorder, and autism, while also supporting their families and the professional communities that serve them by providing a trusted source of science-based education, information, advocacy, and quality resources in the community. Today, we are speaking with Johana Lizarraga, Program Coordinator of Outpatient Substance Use Services at Suffolk Avenue for Outreach. Outreach is a nonprofit organization that provides life-changing drug and alcohol abuse treatment and training services in New York City and Long Island. Johana, thanks so much for being here with us today.
No, thank you. Thank you for having me.
So, how about we start by having you tell us a little bit about your role as Program Coordinator at Outreach and maybe provide an overview of the services provided there.
Sure. So, I really want to start with just saying September, the fact that we're having this conversation now, it's perfect because it's National Recovery Month. Mm-hmm. So it's perfect that we're bringing this up now. So I can start off with, I kind of want to give like a little bit of a background to Outreach. I think that'll be helpful. So Outreach first started in 1979. Our mission has always been to build healthier lives and meet the needs of the community we serve. We've evolved through the years and have been able to open multiple locations. We have some in Queens, in Brooklyn, and in Long Island. We have in Richmond Hill, we have an outpatient and an OTI. So we also provide training. It's like a training institute, and it's also our headquarters. We have another location in Ridgewood, which offers services for adolescents, and it's residential treatment. We have another one in Greenpoint, which provides outpatient services, and we have a few locations in Brentwood. It's in Crooked Hill Road. We have adolescent residential services as well as outpatient, and we have another training institute, which I actually attended there myself and was able to get my CASAC there. We have another within the same location, there's a recovery residence for women. And we also offer services in the center of Pilgrim State, which is ORC. They provide outpatient and community residential services for men, veterans. We also have an MAT hub. We have another location in Bellport, which provides outpatient and day rehab. Another one in Roosevelt, which is our newest one. It's called React, and they provide outpatient services. And of course, I'm leaving Suffolk Avenue, which is the one I currently work at, for last. But we offer outpatient services. We have different tracks. We also offer services in Spanish and English for men and women over the age of 18. We have a parole track, a DWI track, a MICA program. We offer peer services, parenting, anger management, evening and morning groups. We are also a component to the women's CR. So the residency I mentioned earlier, we run groups over there. And we are connected to Sun River Health, which is a van that provides medical services to our clients here. So that's pretty much, we do a lot.
That's all?
Okay. So it's a lot. But, if we look into what I do, it's, you never really know what's happening, right? Mm-hmm. When you come in this field, I feel like it keeps you on your toes. It's always exciting because you're not going to be bored. I tell you that much ever. Yeah. So, we manage crisis here. I sometimes when I come in, I have to deal with like medication issues, or, a bunch of emails, answering emails of what's going on. If there's somebody's calling out. I also run groups. I also do individual sessions because as a program coordinator, I carry a small caseload. It's about 10 to 15 clients. So I have the best of both worlds. I have, the management position as well as keeping the connection with the clients and still being a clinician. So I run reports, I attend trainings, we do or events representing outreach, and things like that.
Great. So you mentioned you attended the Training Institute where you got your CASAC.
Yeah.
Can you maybe tell us a little bit more about your personal journey that led you to choose this career and how you got here?
Of course. So I want to talk a little bit also about, I migrated from Peru in 1998. I was 7 years old, right? Having to learn a different language. I graduated from Brentwood High School, went to Suffolk Community College, and then attended OTI. So everything's always been in the center of Brentwood, which is
And OTI is the Outreach Training Institute.
Training Institute. Okay. Yep. I did that for a year, and was able to get my CASAC-T. I did my internship here. I've always been here. I've been here for about 9 years now. Okay. And I started as a secretary here, actually, in 2012. So while I was a secretary, I attended the community college. I did the OTI. So I was doing double schooling and working here part-time while I was a single mom as well. So then I completed that, did my internship here, went to Stony Brook, stopped attending school for a little while. And, I was hired as a part-time, then a full-timer counselor here. I helped grow the Latin community, like the track that we had, the Spanish track. And at some point we had about 5 clinicians, which was amazing that, that offered Spanish services. Mm-hmm. But then, COVID hit and things became a little bit more challenging for us. I decided after COVID, I think everyone went through a little bit of a crisis where you were questioning what you're doing, right? And I ended up losing my father due to COVID. Sorry. And having a discussion with the director, after I took some time because I really needed, I'm an only child and I'm very close to my mom and dad and my daughter. So going through a very hard, difficult time, I was able to get the support from my team members. And, they told me, what is it that you really want to do? So after taking some time off, I came back, not that I left the job, but I just took a little bit of like a vacation time to just recuperate and get my thoughts together. And I realized this is truly what I want to do. And, they have a great program. They offer tuition reimbursement here. So they said, great. Let's go back to school, right? Do it. We support you. I did online in New Hampshire University, completed my bachelor's in psychology in 2021. I'm now attending Adelphi for my master's in social work. Wow. And I get the support from them, right? So started off as something as simple as a secretary to now a program coordinator here. And I realized that after going through like multiple challenges, my passion is working in the field because I realized that despite the rough days, making an impact in someone's life that leads to change is truly my passion. We all have a voice, and I think that it's our duty as a community to learn to utilize it for those who fear to utilize their voice. And I think together we can create change and definitely save lives.
Yeah, you're certainly doing that. So you've mentioned a few times about the Spanish-speaking community. So you do work with the Latin community primarily. Is that all the only population you work with?
Yes. So
Okay.
when I first interned, I started working with women. And then because I spoke Spanish, we figured why not offer those services, right? So I've always pretty much served the Latin community. And it's been challenging, right? In the community, it's not always accepted, or it hasn't always been accepted. The fact that treatment sometimes has been rejected because
Mhm.
there's so much taboo around it, right?
Right.
So it's definitely it's been challenging to work with them, I would say, but also very rewarding to be able to see the outcome of the change, right? Of planting that seed type of thing. So yeah.
Great. And so you say it's been challenging. What are some specific challenges that you've had to face, and you and others in the field serving the Latin community?
So I would say that there
And
isn't,
you mentioned the stigma and the taboo, and getting
yeah,
past that, I'm sure is part of it.
no, it is, but also I think there isn't enough maybe opportunities for people to obtain their education, perhaps in this
Hmm.
field. There isn't a lot of promotion of it. Um, and I've noticed that the younger generation who are coming into this field are not always fluently in the
Mm.
language, which you know it's an issue, right? I think along the line sometimes the people who migrate to this country, it's almost like they're leaving everything behind, including the language. They're forced to learn another language,
Interesting.
and
Hmm.
they're not teaching their children, their native language.
Hmm.
So it's challenging sometimes when we get people who apply, and I'm speaking to them, and the language they're not fluent. So they're not going to be able to serve that
Yeah,
community.
sure.
And there isn't enough. I can't stress enough that there isn't enough clinicians
Oh,
who
okay.
speak the language and can serve, our communities. There's so many people that have decided to leave the field.
Hmm.
I had mentioned before we had 5 clinicians,
Yep.
and now it's uh, there isn't many. I'm down to 2.
Yeah, that must be
So
tough.
it's me and someone else. So
Hmm.
the stressful part about it, I believe, it's the large caseloads, right? I want to serve everyone. I was actually saying that to a group the other day. It was more of like, I wish we could have so many more, but because COVID hit, we had to reduce our the quantity of people we serve in a room. And we used to have group rooms of 15 people, where now we had to reduce to 6.
Oh,
And we
wow. So
recently increased.
yeah, and you are having things in person. It's not just all virtual.
Yes, we do
Hmm.
everything in person.
Okay,
We
everything.
offer telehealth if it's
Hmm.
needed, but because we deal with people who are mandated, it's better to have them in person.
So how receptive do you think the Latin community is now, versus in the past, to receiving help for substance use disorders and mental health issues?
I think that there's definitely been a change. I've noticed that when I first started, the substance was only alcohol, first of all, and
Mm.
there's no such thing as marijuana, cocaine, or crack, or
Hmm.
heroin, or anything of that
Okay,
nature, at least in Long Island, or where I was at.
right.
And it's now so much more broad. They're more open to talking about the trauma and the issues that led them to the use, and what they've tried, and the feelings and emotions around all of this. I think that after COVID, there's so much more promotion of mental health, that they're more open to it. And there's implementation of the trauma screen, and all of these things that really trigger further conversations, not just the substance use disorder that they're coming for. It's now so much more, and it's a combination of everything.
Right. So it started out as just alcohol, and now it's everything. Is there something in particular today in September of 2022 that is really kind of pervasive in the community as really a big problem?
I think for the Latin community, it's heavier on the alcohol and the cocaine.
Okay.
Whereas, in the English speaking tracts, it's heavier on marijuana and opiate use.
Right.
So that's the difference that I've seen.
Sure. So this is clearly a stressful job. And you and your colleagues must have to deal with burnout. How do you handle that as you guys as substance use disorder counselors?
So we're very fortunate to be able to offer supervision. So we have individual supervision on a weekly basis. We also have case conferences, which is like we all get together once a week.
Oh, okay.
For about an hour and a half, I would say. Sometimes we go over a little bit on a weekly basis. We also have a great team. I'm very fortunate to work with such a great team. We have 3 supervisors here, so our doors are always opened. And we talk to each other. I think that is the best way. You really, after a session, if you've had a really heavy session, you kind of go and talk to someone about your feelings, right? What you're feeling, if there's some countertransference going on, like what's happening at the moment for you, if you feel it like it's a very heavy session. We also encourage self-care. The company gives us, personal days and days off sometimes. So if you feel like you're overwhelmed, like we encourage it, take a day off, take a day off, do something for yourself. Personally, for me, I take therapy. I have a therapist. I see one every week. It's been like that for years, and it's been very helpful for my own growth and my personal self-care.
Sure.
She encourages me to go out and do things I love.
Yeah, definitely. So it's that's great. There's such a support. It's almost like a supportive family.
Yes.
It sounds like.
We eat together. That's another thing. We eat together when we're stressed. Sometimes it's horrible. It's a horrible coping skill, but we'll say, "Are we ready to order tacos today? Are we ready?
Yeah.
We're ready."
Yeah. So we've talked about some of the challenges and the stress. So what are some of the highlights that come with your work?
Okay. Well, I think there's just so much. I would say that when the people that get into this field, it's really because you're passionate about helping others, right? But for me, it's about being able to see the progress, no matter how small it may look like. You're planting the seed for someone. You're doing this change. You are helping others get to where they need to. People who come here are mandated, and I'm not going to take, I can't sugarcoat that.
Right.
And sometimes that can be a little bit of a challenge, because we struggle to get them to want to see the help that they need, right? There's a difference between seeing somebody who wants to help versus somebody who doesn't know how to ask for it. It's not that they don't want it, they just don't know how to ask for it, or they don't really know that it is an issue in their life.
Sure.
So engagement, it's something huge for us, and we get pushback. And the other day I was talking to someone about the difficulty of realizing you really can't do this on your own. As much as you want to think you can, you really can't. And getting there, it's a little difficult, but it's also rewarding. It's rewarding to see that, wow, it took us this long to get to the conversation of, you know what, maybe I need this. And it's not about, I always say, I'm not here to tell you the answer, right?
Mhm.
I'm here to help you find the answer, whatever that means for you.
Right. Sure. It must be really gratifying to see the progress for people going from when they're really struggling to, and of course, it's still going to be an ongoing process in their life in recovery, but just kind of reaching certain milestones and helping them, directing them towards the path to,
Right.
continuing in their lives.
Right. And it just because something means something to me doesn't mean it's going to be effective for them. So it's really working, being more person-centered care and working with them to achieve their goal, whatever their goal is, right?
Right. I'm sure every situation is different.
Yeah. Yeah.
Um, so given the workforce shortage, you're having trouble filling positions, especially in Spanish speaking clinicians and counselors. Um, can you provide a message of inspiration and maybe hope for younger people who are considering, or not younger people, who are considering a career as a counselor, working with people living with substance use disorders?
Sure. Um, I can say that, this field is a growing field. There's so much need for the services, and you will have multiple opportunities. There are so many agencies who provide different tracks or different things that you may be interested in. I think it's really important to remember that it's really about changing one person at a time. And I guess for me, it's, I guess the biggest message for me would be the substance use field is challenging, but it takes a special individual to want to go on a journey with a powerful meaning to change the world through healing, recovery, and learning to advocate for those who truly need it.
That's a nice message. And, I have to thank you and everyone that's doing what you're doing. You're really making a difference in people's lives, but also just the overall community. So I think that's a good place to stop. I really value our time together, and I want to thank you for taking the time to talk with me. It's been such a pleasure to speak with you.
Oh, same. Thank you for having me here.
Absolutely. And for those watching, for more information about outreach, please visit opiny.org and stay tuned for another installment later on of the Behavioral Health News Spotlight on Excellence series. Thanks a lot.